Retirement, the golden years, the time to kick back, relax, and finally take up that hobby you've been talking about for 20 years. Like knitting or skydiving. No judgment here. But wait, before you ride off into the sunset, let's talk about the one thing that might sneak up on you faster than your grandkids asking for Wi-Fi. Healthcare cost. Medicare, deductibles, long-term care. Sounds more confusing than trying to assemble IKEA furniture without instructions. And while helpful in some circumstances, Life Alert is not a proper plan for healthcare and retirement. But don't worry, if you have questions, you're in the right place. In this webinar, we'll break down everything you need to know about planning for healthcare and retirement. So let's dive in. Please welcome from Towerpoint Wealth, President Joseph Eschleman, and Financial Planning and Coaching Strategist at Vanguard, Julia Fuentes.
Well, good afternoon, everyone. Thank you for joining us for the Towerpoint Wealth webinar focused on healthcare, health insurance, all of the costs associated with those, and how to manage some of these responsibilities and some might say liabilities. We're thrilled to have you here as we dive into one of the most critical and often confusing aspects of both pre- and post-retirement planning. That is the ever-expanding costs of healthcare and how to properly navigate and manage the system. So if you're thinking about retirement, you probably asked yourself, how do I bridge the gap before Medicare? Perhaps what exactly do all of these Medicare Parts A, B, C, and D really cover? And how can I keep my healthcare costs from eating into my savings and investments? Well, you're in the right place because today we're going to break it all down, covering some key topics like pre-retirement and pre-Medicare insurance options, so you're properly covered before Medicare kicks in. Medicare 101, what you'll need to know about A, B, C, and D, all of those magical parts. Some smart tax strategies to help manage healthcare costs in retirement, and how your income affects Medicare premiums, and how to avoid unnecessary surcharges. Plus, we'll wrap things up with an open Q&A where our featured healthcare and insurance expert, Julia Fuentes, will answer all of your biggest follow-up healthcare and insurance questions. So of note, Julia currently serves as Vanguard's financial planning and coaching strategist. Since joining Vanguard in 2008, Mrs. Fuentes has assisted financial advisors with both their investment strategy and practice management needs. Prior to Vanguard, Julie was a financial specialist with Wachovia Securities and a credit manager at Wells Fargo Financial. She earned her BS in Finance and Marketing from Bloomsburg University, which just so happens to be located in my home state of Pennsylvania. So sit back, take notes, and enjoy today's webinar. A few housekeeping items. All webinar participant lines will be muted, but there will be a live Q&A at the end of the webinar. If a question does happen to come up, please ask it virtually with the chat function of Zoom. We'll certainly log all questions and try to answer them during the Q&A. Be sure to adjust your audio settings on your computer or device, and you'll all get a recording of the video and the accompanying slides within the next 48 hours. So with all that being said, I'd like to turn it over, Julia, to you. Thank you for your time and your counsel today, and the floor is yours.
Thank you so much. So I think they're going to pull up my slides right now, but we're talking about a topic that I'm very passionate about today. So if we can go to the agenda page, we are going to run through how to plan for your retirement healthcare costs, which includes going through the ABCs of Medicare, what we call Medicare's alphabet soup. We're going to talk about your income and how the income on your tax return can affect what you're going to pay on a monthly basis for Medicare. And we're going to wrap up with a conversation on long-term care. So to get us started, on the next slide, there are two buckets that we need to plan for when it comes to your healthcare in retirement. So on the next slide, on the left-hand side, your traditional health healthcare costs. You go to the doctor, you get your prescription drugs filled at the pharmacy. These top two line items, those are going to be covered by your Medicare plan. But then there's other out-of-pocket costs that we face in retirement that original Medicare does not cover. And that would include dental. A great starting point for retirees when it comes to dental is to talk to your dentist that you want to go to in retirement because they can usually give the best advice. Some people will choose to buy a dental insurance plan. So some people will choose to just pay out of pocket. So my aunt, she has been paying out of pocket ever since she turned 65, went on Medicare, but she just had to get a root canal. So those are pretty expensive. She had to fork out a couple $1,000s. So talk to your dentist. I know my dentist in Pennsylvania, she offers her own insurance plan through her private practice. So start there, talk to the people at the front desk. Now, vision. When I say vision is not covered by Medicare, what I'm talking about is your routine vision, your eyeglasses, your contact lenses, you're getting an eye exam. If you have an eye problem, such as many of us, unfortunately, will need to get cataract surgery at some point in time, and that will be covered under Medicare, your eye problems. It's just many people choose to just pay out of pocket for buying new eyeglasses.
And is that
And
just
then
because it's not covered by insurance typically, Julia?
yeah, so for original Medicare just doesn't cover, routine vision, only for problems. So
Okay.
some people will pick up, I see less people do the insurance plans, but some people have like VSP or they'll pay something. That's for people that are buying glasses each year. But this is another reason why, do you ever go to like BJ's, Costco, Walmart? You see all the retirees lined up at the Vision Center.
Right.
It's usually because of this. So they're just
Got
paying
it.
out of pocket, saving some money there. Same thing with hearing aids. Unfortunately, right now, Medicare doesn't cover you for your hearing aids. So my father-in-law, he just got some from Costco and he was dancing on the floor of a wedding and one fell out of his ear. And Costco actually replaces it if you lose it within a year. So a couple $1,000 there. When it comes to your traditional healthcare costs, you don't need to think about this as a big, scary number because you're going to see news articles saying, hey, typical American needs $300,000 for your healthcare costs in retirement. But I've never seen a news article saying, average American needs $500,000 for your food in retirement. So we don't need to be scared by this. This is just part of our budget. We're going to break it down. What is your annual cost? What's your monthly cost? Now, on the right-hand side, long-term care. As we age, some of us just need a little bit of help. We need help getting out of a chair. We need help going to the bathroom. And unfortunately, Medicare leaves us on our own there. You have to pay out of pocket. So this is a risk. You might not need any help. You might need a lot of help. We just don't know. So for this bucket, we want to think about and talk to our financial advisor. We know this is a risk. We don't know how much we're going to need here, but we do want to plan for this bucket on its own, something that is a risk. And I often get asked, well, doesn't the government pay for your nursing home care? I think that they do. And what you're thinking of is Medicaid. Medicaid aids the poor. Medicare cares for the elderly.
And in California, it's Medi-Cal, not Medicaid, correct?
Yes, yep. Everybody does it a little different. It is state specific, but regardless of the state that you're in, you need to have very low assets, very low income to qualify. So it's a last resort, not really a way we plan for this bucket in retirement. So if we can go to the next slide, the number one question that is on a lot of people's mind is around, I'm turning 65. Do I have to do anything? It's like such a scary age. Like, what's going on? I'm so confused by if I have to do anything. And the answer is, well, it depends. Of course, it's a government program. It depends. If you are retired, You are going to want to sign up for Medicare 3 months prior to your 65th birthday month. If you sign up in the 3 months ahead of your 65th birthday, your coverage will start on day one of your 65th birthday month. You also have 3 months after your 65th birthday to enroll. This is called your initial enrollment window, the 7 month window surrounding your 65th birthday. And this is important because you can't sign up for Medicare whenever you want to. It's only in specific enrollment dates, and this is your first opportunity. So, initial enrollment window. But you might be saying, well, I'm still working and I'm going to work until I'm 75. Or maybe you're retired, but your spouse is still working and you are on their health plan through their employer. Well, I have health insurance that I'm really happy with. Do I have to sign up for Medicare? And again, it depends on your health insurance. And the way you can protect yourself is just to talk to your benefits coordinator through your employer and find out, do I have creditable health coverage, which will allow me to delay signing up for Medicare until later in life? So the risk here is if you are a small business owner or you work for an employer with 20 employees or less. In this case, many of these small employer health insurance plans are not creditable health coverage, and you do need to sign up for Medicare to avoid coverage gaps and penalties. But many of us work for the larger employer, more than 20 employees. In that case, you usually have an option to make. If you have creditable coverage through your employer, you're going to want to compare. Am I getting the better value from my work plan, or should I check out Medicare, and is that the better value? If you've decided, I just want to stay with the insurance through my employer, you can get later in life when you retire, you will get what is called a special enrollment period. This is an 8-month window following your loss of coverage that you can sign up for Medicare without any penalties. People do this all the time. There's just a simple form that your employer signs off saying, hey, from 65 on, you had creditable coverage, you're good to go. So check with your benefits administrator if you're considering delaying. So the next slide, you might be thinking,
Julia, quick question.
oh, yeah,
What happens
sure.
if you miss the 3-month window both prior to and after 65?
Yeah, so if you miss your initial enrollment window, you don't have creditable coverage through an employer, you have to wait for general enrollment. That runs January through March of each year. And then that's early in the year, but you will face late enrollment penalties then for doing so.
So there could be potential loss of coverage if you're not on top of this?
Yeah, so some people, they can they might get some private insurance that can cover them through that period.
Or
But
COBRA, perhaps?
Yep, a lot of people that, like, I'll give you an example. We're going to talk about COBRA in just a second, but I had somebody that he was 67 years old and he had the creditable coverage that we were just talking about. He gets laid off, very unexpected. He had no idea this was going to happen, and he always intended to get another job. So they just went on COBRA. And COBRA just means you can continue with the exact insurance you had through your employer. It continues as is. It's easy. But COBRA is a short-term solution that is only going to last 18 months in most situations. So what happened is he had missed his special enrollment period. We just talked about 8 months passed. He still didn't have a job. Then his COBRA started to run out that next year, and he went, oh,
right,
I'm going to sign up for Medicare now. He had to wait until the general enrollment period. So they make it a little bit complicated for us. So people that make mistakes, sometimes it gets to be a big mistake in the end.
Yeah, got it.
So
and
you might be.
A quick question. I apologize.
Sure.
Yeah.
Yeah.
Can you sign up and defer taking Medicare insurance?
So when you're signing up you're signing up for something. So we're going to be talking about the parts of Medicare next. So a lot of people sign up for Part A because it's free. So a lot of people say, oh, well, I called and I signed up and I deferred. But what really they deferred is they deferred Part B and they signed up for Part A. So we're going to walk through those parts in a bit. When it comes to retiring early, you might be thinking, who works until 75? She's insane. No, I'm retiring at 55, 60, I'm out. Well, you need to bridge the gap to get to Medicare because we can't go on Medicare until we're 65 unless we are disabled. Some people qualify earlier. So how are we going to bridge the gap? If you have retiree health benefits, which consider yourself very fortunate if you do, they're starting to dwindle. Less and less employers are offering this, but retiree health benefits are typically one of the better choices. Now, I want you, if you have retiree health benefits, I want you to understand how this works when you turn 65. Most of these retiree health benefits, when you turn 65, you still need to sign up for Medicare, and your retiree health benefits will convert to a Medicare type of plan. So ask that question before you retire. I've had some people make the mistake that they didn't understand their retiree health benefits, and their contract said, hey, if you're retiring and you're over 65, you have to sign up for Medicare or you permanently forfeit your retiree health benefits. Wow. So try to just do with a little due diligence. Hey, how does this work? And how does it work when I turn 65? What can I expect? And they should be able to fully tell you the process so you know what to expect. Now, spouse's health plan. Some of us can convince our spouse to continue to work while we retire and go on their health plan. So that's always like a great option. We know it doesn't work for all of us, which brings us to COBRA. So we talked about COBRA, how you can continue with your insurance that you had. It's very simple, same insurance card. But the downside here is it's a short-term solution. So most people, voluntary retirement, you're going to get 18 months of coverage. So it might be able to bridge a short gap if you're 63, 64. Also, another downside is COBRA can be quite expensive. It's different for everyone. You want to check with your employer because it's going to be a different quote depending on your employer. But it typically is expensive because now you pay what you are used to paying, what your employer subsidized for you, and an additional 2% administrative fee. So many people turn to the Affordable Care Act marketplace plans. If you go to healthcare.gov, select the state that you are a resident of. So if you're moving and you're moving out of state, select the state you're moving to so you can get an idea. The plans are different, the prices are different. It is very important to work with your advisor on income planning. If we can keep your income low enough, you can qualify for what they call premium tax credits. And you can get them advanced to you to lower your monthly premiums on these plans. So I'm seeing people with incomes of $250,000 in some states get a pretty decent subsidy. They do expire at the end of this year. We're going to see, read the news, and we'll see what's happening with these Affordable Care Act subsidies. They could extend them, but right now, people with higher incomes are qualifying for subsidies. We'll see what happens going into next year in 2026. If your income is very high, you don't qualify for any premium tax credits, you don't get any subsidies, you most likely are going to shop with private insurance to see if you can get maybe a better coverage network. Since you're paying a lot, paying the full boat, maybe you can get some additional benefits. So
that's something at Towerpoint, if I can quickly interject.
Yeah, sure.
With two different professionals who help us help our clients who are 50, 55, 60, pre-Medicare to go out and shop that environment and figure out what's best for them. So it's definitely a direct resource that we're happy to connect clients to help make intelligent decisions about.
Yes, it can get quite complicated. So it's always great to work with
Yeah.
someone to handhold you through all your options. It can get a little overwhelming. So if we can move to the next slide. So now we are going to go into the ABCs of Medicare, what we call Medicare's alphabet soup. So on the next slide, Part A. Part A is the one part of Medicare that is free. This is free to those of us who have paid into the system for 10 years or your spouse has paid in for 10 years. Since Part A is premium free for most of us, this is going to cover you for when you are admitted to a hospital, so inpatient hospital stays. So since it's free, most people sign up for this at 65. And this is where a lot of people say, well, I didn't really sign up for Medicare. I pre-registered for it. I hear that a lot. I'm like, well, what you did is you signed up for the free part of Medicare, Part A. So if you get admitted to the hospital, which we hope you are not in the hospital, you'll get additional coverage that will, pay a little bit more if your work plan doesn't pick up a lot of it. With Part A, there is a reason you would not sign up for Part A at 65. And this would be if you are somebody that works for that larger employer, you're going to continue to work past age 65, and you have a high deductible health plan through your employer that you love, you're going to stay on that plan and you want to contribute to a health savings account. If you sign up for Part A, you are ineligible to contribute any more money into your health savings account. You can still spend from it, you just can't save anymore. And the thing that makes this even more confusing is when you take your Social Security benefits. They force you to take Part A if you're getting it premium free, which a lot of people wait until, later than 65. So maybe you're 66, 67, 70 when you're taking your Social Security benefits. They are going to backdate your Part A effective date by 6 months, which means if you're somebody that wants to contribute to an HSA after 65, you need to prorate in that year that you are going to go on Medicare or you are going to take your Social Security benefits. So work with your advisor on that. If you don't have an HSA, sign up for Part A in the 3 months ahead of your 65th birthday. Now, Part B, this is the part that comes with a cost. And this is the part that a lot of people that are still employed, they look to delay until later in life. The minimum that anybody's paying in 2025 for Part B is $185 a month. Once you start taking Social Security, they net that Part B premium right out of your Social Security check. Everybody else gets billed quarterly, or you can set up automatic payments. So the reason why it's important to understand Part B is this is the one that comes with permanent lifelong penalties if you get it wrong. So let's say you're a small business owner and you don't sign up for Medicare because you have health insurance. Why would you sign up? And now you sell your small business when you're 70 years old, 5 years has passed, and you find out I didn't have creditable coverage. I didn't realize my health plan wasn't deemed creditable. There's a 10% penalty for every year that has passed. That's a 50% penalty tacked on to Part B forever. You can't reverse it. So worst I've ever seen personally, and it was a small business owner, unfortunately, 180% penalty. He had let 18 years pass. There are red flags along the way, because that was my first question. I can imagine there had to have been a lot of red flags over 18 years. He said, there was. He said they asked for his Medicare card every time he went to any doctor's visits for 18 years. He just couldn't understand why they kept asking him, why they kept sending him bills. And I said, well, what did you do with the bill? He said, I paid it. He just paid them. So red flags, you probably won't let 18 years pass. The other thing that confuses some people, if you took your Social Security benefits early, let's say you took them anytime like 4 months prior to your 65th birthday or earlier, you will get automatically enrolled in Part A and Part B. They send you your Medicare cards in the mail. You should get them a couple months before your 65th birthday. But everybody else has to take action, go through the Social Security Administration to enroll. A lot of people will do it online through ssa.gov. Now, the combination of Part A and Part B is what they call original Medicare. And original Medicare, you can stop there if you want, but the risk is there are unlimited out-of-pocket costs. And to simplify it, it's 20% out-of-pocket. So if you need to get a $50,000 chemo treatment, you owe $10,000 out of pocket. So a lot of people don't want that. That makes them concerned. Hey, there's unlimited. There's no out of pocket max. That's correct. So if you can go advance one more slide, this is where you have a decision to make. So I don't want that unlimited out-of-pocket cost. So now I'm going to go and buy an insurance plan from a private insurer. Names like Aetna, Cigna, Humana Gold, United Healthcare, lots of different insurance providers. And assuming that you don't have retiree benefits, you don't have TRICARE for life as a retired military veteran, and you don't work for that small employer where your small employer health insurance is going to pick up those secondary costs, you're going to have a choice to make. And your choice is going to come down to, do I choose a Medigap plan, also called a Medicare supplement plan, or do I choose Medicare Advantage? So we are going to talk about both of them, but we're going to talk about Medigap first. Medigap covers the gap in coverage if you only had original Medicare. So with Medigap, you're going to have your Medigap plan, but you also are going to have to choose a Part D drug prescription plan, a standalone plan. Now, drug plans can get pretty confusing, but there's a lot, depending on where you live, geography plays a role in this. There's going to be at least 10 drug plans available to you, and it's all dependent on what drugs do you take, where do you go to get your prescriptions filled. And not all drug plans cover all drugs, so you need to find one that matches to you the best. So my mother, she pays $1.70 a month for her drug plan. Some drug plans are over $100 a month. If you're somebody that maybe takes a bunch of brand name drugs that are more expensive, there might be a drug plan that has a higher premium that will cover you. Starting in 2025, they passed drug reform saying that nobody's going to pay more than $2,000 in out-of-pocket drug spending for Part D. So you pay your monthly premium and no more than $2,000. Some people, they can't find a drug plan that covers their specific drug, that they have to go outside of their drug plan to get that filled. So if it's not a covered drug, you will still have to pay for it through your Part D. So the $2,000 is just for the covered drugs. Now, a lot of people will say, do I have to take Part D? It is optional, but if you decide at 85 when you're taking a bunch of drugs that that's what I'm going to sign up for it, they do have a late enrollment penalty. There's a 1% penalty for every single month that passes after you're 65, and that's going to be tacked on to the national average base premium, which is around $35 a month this year. So you pay now, pick an inexpensive premium, or pay later with a late enrollment penalty that is a lifelong penalty.
Are you allowed to switch which plan you're looking at for Part D?
Yes. So it's highly advisable that every year during open enrollment, which is at the end of each year, October 15th until December 7th, you're going to shop your plan. because our situations change. Maybe we're starting to take another drug, but also the drug plans change. Their formularies change. Your drug might not be covered next year. So we want to check, are our drugs still covered? And we want to check, are we in the best plan with the most affordable premiums for my situation? So annual homework on drug plans.
Well, it does sound like it's advisable to sign up for Part D, even on the most inexpensive level, rather than get dinged for that penalty by not doing so.
Yep, I mean, some people, hey, roll the dice and they said, I'll just deal with it later. But
Right.
if you don't want the penalty, you can pick up, as of right now, you can still get a very inexpensive drug plan. Even there are zero premium plans in some states still.
Got it.
With
Quick aside, Julia, apologies for interrupting.
Yeah.
Are Medicare beneficiaries, are they able to keep an ACA plan after they turn 65, or do they have to switch to Medicare?
They have to switch to Medicare. So COBRA and the Affordable Care Act plans are not Medicare delay eligible.
Yeah.
So you are able to, just for Part D, if you're still working and you have a creditable drug prescription plan, you can delay Part D since you have that creditable plan. And then when you retire, you can pick up a Part D, just like you can with Part B.
Got it.
With Medigap, we're going to look at the Medigap plans next. I want to point out the mistakes some people make, and it's just for awareness. The first time you sign up for Part B, you will get a 6-month window to pick up a Medigap plan with no medical screening. After the 6-month window, they can deny you coverage based on a pre-existing condition. So sometimes the first time you sign up for Medicare could be the last time you can get one of these Medicare supplement plans. So if we can move to the next slide, this is going to blow your mind. You're like, why are there more letters? Like, can there really be more? Why? So why do people choose the Medigap route? So this is for people that say, I don't want to deal with networks. I don't want to deal with authorizations, pre-approvals. I'm willing to pay up on a monthly basis. So I'm going to pay up, for one of the better Medigap plans, like Medigap G that's highlighted here, $100 to $300 a month could be your monthly premium on that. So not inexpensive, but you can go to any doctor in the United States. If they take Medicare, they take your insurance. So you don't have to deal with networks. The downside is it comes with a higher monthly premium on these plans. I am going to simplify this. So let's say you've chosen the Medigap route. Hey, I just want to pay up for coverage that I don't have to deal with any hassles, and I want to pay for that. Well, you would select the Medigap route, and the federal government sets these letters with corresponding benefits. Medigap C as in Charlie, F as in Fantastic are closed to new enrollees to Medicare. So they still exist because people are grandfathered in them. But if you are signing up now and you weren't eligible for Medicare prior to 2020, you can't get those. The Medigap plan that is the most popular is Medigap G, the really great plan. After you meet a small Part B deductible, then all of your other out-of-pocket costs will be covered. So you'll see, this is actually showing the 2024, but $257 is the Part B deductible. And then, hey, you don't have to pay a copay when you go to the doctor. If you go into skilled nursing, because let's say you got a knee replacement, you're having a little struggles, they send you to skilled nursing because you're improving in health. If you're in there for 21 days, you have to start paying a small daily fee. Your Medigap plan will pick that up. Part A, you get admitted to the hospital. There is a cost that you're going to have to pay, a deductible. You might have to pay it more than once in a year. So the second most popular Medigap plan is Medigap N, the really nice plan over on the right-hand side. So with Medigap N, the difference between the two, N will have a lower monthly premium. But you will pay $20 to go to the doctor as a copay, $50 when you go to the ER. They won't cover something called Part B excess charges. There are some doctors that believe they're worth more than the Medicare negotiated rates, and they can bill you legally 15% above the Medicare charge, pass it along to you. It's very uncommon. So a lot of people say, hey, I want the lower monthly premium. I'm willing to pay the copay. So to give you just like an idea, my mother, we're in the state of Pennsylvania. She's in her mid 70s. She pays $175 a month for Medigap G. She could do Medigap N and be somewhere around like $145 a month. So lower monthly premium, but she doesn't have to pay copays to go to the doctor. Keep in mind, Medicare covers you in the United States. If you're somebody that wants to go live in a foreign country for 6 months, you're going to want to seek out travel health insurance benefits, or you might want to find a Medicare Advantage plan with some foreign travel health benefits, which if we can go to the next slide, we're going to talk about Medicare Advantage next. So we just talked about original Medicare, add a standalone drug plan, add a Medigap supplement plan such as Medigap G, get your worst case scenario protection, go to any doctor in the country. If they accept Medicare, they will take your insurance. Your other option is sign up for Part A and Part B, and now you qualify for Part C. Medicare Advantage. We have two names for everything here. So it means the same thing. Well, Medicare Advantage, it's offered by the same private insurers that offer Medigap. So you are going to, it's a little confusing if somebody says, oh, I have Cigna. You're like, well, do you have Cigna Medigap or Cigna Medicare Advantage plan? And also Cigna might offer multiple iterations of Medicare Advantage plans. You're going to get marketed to. You're going to have 30 mailers every year. They're going to robocall you when you turn 65. And you might be wondering, why do I keep getting these calls? It's because this is one of the most lucrative business lines for insurers. The government will pay them to take you on as a participant because they're covering your claims when you go to the doctor and the hospital. The more people that they can get to enroll, their financial ratings as an insurer can improve, and then that comes with additional financial incentives. So it ends up being a numbers game. Hey, we need to get bodies in the seat. There's never any medical underwriting for Medicare Advantage. You can always get into them. Every Medicare Advantage plan has to set a max out-of-pocket limit, and it can't be more than around $9,000 for in-network service. A lot of these Advantage plans will set that max out-of-pocket even lower than what the federal bar is. So what people love about Medicare Advantage are the incentives. Since they're trying to get you to sign up, you'll see zero monthly premium. We'll give you some dental vision benefits, a toaster oven, dinner with a celebrity, money towards your groceries, all kinds of different things. They're very creative. And it's the package deal that people like. What you need to understand is, what are my out-of-pocket costs for care? Because every plan is different. If you go to the doctor, do you have a copay? If you go to a specialist, what's the copay? If you go to the ER, if you need to get a surgery, do you owe 10% up to your max out-of-pocket limit? So read the details. You also need to understand what's the network of doctors. If I live between two states, can I go to doctors in both states? There are a lot of Medicare Advantage plans that are HMOs, but you will find some PPOs that have national networks. You just really have to pay attention, understand the network, also understand the authorizations. Hey, if I need to get a knee replacement, am I going to have to wait 6 months to get it done? So just awareness there, nothing wrong with them, but just some people complain about, the network. So I like to pick on my mother, use her as an example. So she's very healthy. and she has no underlying conditions, but she tends to be accident prone, even though she would not say she's accident prone. She is. So since she's turned 65, she's had quite a bit of accidents. So she's in this Medigap plan, which we just don't have to deal with it. She can go to any doctor she wants. So to give an example of an accident, she gets a recluse spider bite back in 2021. Yeah, it's very strange. Like, who gets them? But she did somehow. We don't know how. She lives on a farm, and there's a lot of like gnarly looking spiders out there, real strange ones. Now I'm terrified of all spiders. But she goes to her primary care doctor, and they don't know what it is, so they send her home with an ointment. No copay. She goes to the doctor or to the ER a couple days later. She's in severe pain, and they believe it got infected. So they send her home with an antibiotic. She takes the antibiotic for about 10 days, and she deteriorates quickly. It's not getting better because it's not an infection. It's a poison. So now more time has passed, and the poison is eaten into her body, and she now has a hole in her chest. So we're able to call a specialist that specializes in insect bites. And this was a dermatologist who has decided not to accept any Medicare Advantage plans. She only takes Medicare. Since she takes Medicare, she takes her insurance. We get an appointment right away. Within 5 minutes, they diagnose her. She gets sent to the hospital. She does 20 days in the hospital. She needs reconstructive surgery on the hole and a year of dermatologist visits. What did she pay? She had to pay her Part B, of course, and her $175 a month for Medigap, but she was covered. With Medicare Advantage, she would have had to find a dermatologist in network, and yeah, they probably still could have diagnosed her maybe with a little bit more hassle along the way, and she would have costs along the way, co-pays to go to the different appointments. The surgery might have brought her up to her max out-of-pocket limit. So in the year with the accident, she probably paid less with Medigap over Medicare Advantage, but a lot of healthy people, they'll pay less in Medicare Advantage over time. With the package deal, I have a condo in Florida. A lot of my neighbors have Medicare Advantage. What they complain about the most is the authorizations. Oh, I just want this surgery and my cardiologist won't give me the authorization. I have to wait another 6 months. So like little things like that, some people say, I've been dealing with this my entire life. Why would I change it now? So pros and cons to everything. And if we can go to the next page. Now, to bring it all together, we talked about hospital. Part A is free. Part B, nobody can escape the, over $2,000 we all have to pay. Drug plan, national average annual premiums, $420, plus no more than $2,000 of out-of-pocket drug spending on covered drugs. And then Medigap G, depends on where you live, what it's going to cost. But in the state of California, they have some additional protections. We talked about the first time you sign up for Part B, you will get a 6-month window to sign up for a Medigap plan with no health questions asked. They have to give you the best available rate. In the state of California, they have a birthday rule. If you are in a Medigap plan, you are able to switch your Medigap plan with no medical underwriting, have the insurance providers vie for your business once a year around your policy anniversary or around your birthday. But if you're in Medicare Advantage, you're going to need to go through the health screening to get into Medigap. So it's still additional protections relative to some other states. But where you live really can determine your costs here. And then if we can
advance other variables that could make Medicare premiums more expensive besides your state of residency?
So it's your state of residency. It's also your, like, if you're going through the medical screening, if you're sick and they're not going to deny you coverage, they can price you on the higher end. And also in many states, they, including California, you'll see they price a lot of these Medigap plans based on your age. So as you get older, your premiums can go up with inflation plus your age. Some states do attained age, like, hey, when you buy the policy, we're going to lock you in at this age and we're not going to increase it because of your age. But in California, you're going to see a lot of the plans, like they're going to just creep up slowly as you get older. You always have the option to move to Medicare Advantage with no medical underwriting.
What about income and how does that affect premiums?
Yep. So if you can advance to the next slide.
Teed it right up for you.
One of the biggest factors here when it comes to Medicare and planning with your financial advisor is how the income on your tax return can affect your Medicare premiums. So we can follow up here with the 2025 numbers, but the way that this works is on an annual basis, the Social Security Administration pulls your tax return from 2 years prior. So your 2025 Medicare premium is based on your 2023 tax return. So it's always a 2-year look back. What are they looking at? They're looking at your modified adjusted gross income. If you pull out your 1040 tax return, you're going to see line 11, your AGI, adjusted gross income. They're going to add to that your muni bond interest from line 2A. Add that together. In 2025, if you're a penny over 212,000 as a married filing jointly couple, you will start to see an increase in your Medicare premiums. So here you're seeing, looking at 2024, everything inched up a little bit going into 2025. So right now, 185 is the lowest that anybody's paying for Part B. And you can see 750,000 and above. This year, it's around $630 per person per month. You'll also notice that they'll tack a surcharge on your drug plan. So everybody has a different drug plan premium depending on the one that we selected. And then they tack that additional surcharge on. So you might be thinking, oh, well, I don't have a ton of income in retirement. I have my pension, 85% of my Social Security benefits are taxable income. I should be able to stay under that limit. But what you might not be thinking about is when you turn 73 and you turn on your required minimum distributions because you're going to be forced to take money out of your retirement accounts. You might not be thinking about you're going to sell your vacation home, which has a huge capital gain. And that capital gain can inflate your Medicare premiums over a 1-year period. Maybe you're going to start a Roth conversion strategy because you want to leave a tax-free legacy to your heirs. Well, that Roth conversion is going to hit your tax return as additional income and can inflate your Medicare premium. So a lot can happen here that you might not be thinking of. It's important to talk to your financial advisor if we're doing something that involves a larger amount of money. Hey, I want to take a lot of money out of my traditional IRA to buy a boat. You might want to do it over 2 tax years to avoid some tax bombs like this. One last thing to note here, if you recently retired and you say, well, 2 years ago, my income was much higher than it is today, there is an appeals form, SSA-44, they call it the IRMA life-changing event form. You are going to want to fill it out and say, I had work stoppage, I retired, my income moving forward is permanently reduced. They will lower your Medicare premiums. Otherwise, you'll pay too much for the first 2 years if you were high income a couple years ago. So
there's an unusual capital gains event. Are you still able to make an appeal in that case?
So what they're looking for here is they're looking for people with assets and income to subsidize more of your Medicare costs.
Sure.
So if you have a capital gain and inheritance, things like that, they say, well, you have assets and income that we were looking for you and they want you to pay more. But if you have something that's like a little bit unusual and you can maybe write a sad story, there is another appeals process. They call it the Social Security reconsideration request. That I'll give you an example of where this worked for me. Somebody was went and didn't really understand Roth conversions and did a $1 million Roth conversion, his entire IRA balance in 1 year. And that was all he had to his name. And he did it all in 1 year. And it set off a tax bomb for him. And obviously, they threw him in the highest bracket. He was living off a fixed income. He literally couldn't afford that. So we wrote, hey, this was a tax mistake, shouldn't have done this all in 1 year. And they were able to reduce it. But if it's, so the sadder you can make your story, the more likely you can make it go away. But
it is subjective in terms of the decision making.
Exactly. It's a gray area. You can always ask, but say, you want to make it like that story, a little bit sad to,
sure. Yeah. Well, and this is some of the work we do at Towerpoint also with clients in terms of trying to manage and amortize income, capital gains, RMDs, Roth conversions to, not completely avoid, the potential consequences of a higher Medicare premium, but if we can be smart about when and how we take income to some degree, it gives us a modicum of control.
Perfect. And if we can we'll wrap up with long-term care is it depends on where you live, what it's going to cost for long-term care. A lot of people want 24-hour in-home care. That's going to be even more expensive than a nursing home. If we can go on to the next slide. There is a risk, especially for women, that will need paid long-term care for more than 5 years. So my grandmother had Lewy body dementia. She fell in the no paid long-term care bucket because she had 4 daughters. And her long-term care plan was, my daughters are going to take care of me. And they did. They each left the workforce, took 2-year increments to watch her. And if you go to the next slide, but let's say she didn't have daughters willing to help, she would have fallen into this 15% that expect to pay more than $250,000 in this bucket. So work with your financial advisor. This is a very customized conversation. Some people have family support, some don't. Some people say, you know what, I don't think my family is going to spend their inheritance to put me in the home I want to go to. So I'm going to buy an insurance policy to make sure that, hey, if they don't use it, it's not taken away from their inheritance. So lots of different insurance cases, different use cases for different personalities. There's also life insurance policies with long-term care riders. So talk to your advisor about the best for your specific situation. And the last slide, just to wrap up, it's a great idea to sit down with your advisor once a year. Do income planning. Your IRMA notices will come in November of each year. Share your insurance policies, especially if you have a long-term care policy. Let your advisor review that. Budget for your health care on an annual basis. Once you're on Medicare, you're going to have homework to do. Every open enrollment, you're going to need to shop your Part D drug plan and your Medicare Advantage plan because formularies change, networks change. Your doctor might not be in the network next year. You are going to want to do your due diligence because Medicare Advantage plans are always changing. And we either, if we don't change our plan, we might have to change our doctors. And if you don't have healthcare directives, we can become incapacitated at any time. We want to get our affairs in order and work with your advisor to talk about your savings strategies because health savings accounts, if you have an HSA, you can fund most of these costs in retirement using your HSA dollars tax-free.
Points, Julia. And I think another key consideration on the long-term care side of things, if you're interested in the insurance, is the issue of insurability as well. Obviously, as people continue to age, that becomes a primary consideration when looking at what the cost versus benefit is in looking at insurance.
Exactly.
Well, Julia, thank you. I think we've answered all of the questions. You've done an excellent job kind of taking us through the soup to nuts circumstances associated with pre and post-retirement health insurance. Do you find that individuals tend to work with a broker or an expert to help them figure all this stuff out, or how many people are doing this on their own? It seems like it could be overwhelming.
I'd say most people choose to work with a broker because what the broker is going to do is, hey, they'll help you navigate. If you're like, well, I'm not sure, do I go Medicare Advantage? Do I go Medigap? Some people are certain, hey, I'm going the Medigap route. I don't want to deal with networks ever again. I'm going to pay for that. Well, the broker can go through all the insurance companies and say, hey, you might want to pay $10 more a month for this insurance company. And here's why: their history of rate increases aren't as much. So over the long term, this is a long-term decision. You might want to go that way. So I'd say working with a broker, they can really help you navigate and choose the best insurance company for you and the best plan for your health situation.
That's great. And most of the brokers, they receive compensation or commission directly from the government. Is that correct?
Yep. So they will, so you don't pay more to work with the broker. You
Right.
do want to check with the broker and make sure they work with multiple insurance companies, not just one, so they can have an unbiased view.
Sure.
But they will get paid on the back end. The insurance company will actually pay them because they are, you know, they'll get paid each year that you stay with them because they're
Right.
servicing the account for the insurance company.
Right. And again, here at
Yeah.
Towerpoint, we have relationships with two different brokers that aren't captive to just one or two agencies. But I think it's important from our responsibility as a fiduciary to our clients to ensure that if we're facilitating introduction, it's somebody that can properly help them and not have commission or compensation necessarily skew the advice or the management that's being given.
Yeah. And if you have if somebody does not trust a broker, and that's just, hey, I'm never going to work with a broker, there is in the Medicare handbook, if you just do an internet search, Medicare handbook, at the end of the handbook, every state is listed with a phone number. They call it the state health insurance program. You can call and they have counselors there that can do the same thing that the broker does. They just don't get compensated. So some people say, the broker gives me really good service, and the state health insurance program
Sure.
service isn't as good, but there
Sure.
are options. So you can get multiple opinions too.
That's great. Well, Julie, I think that wraps things up. We've answered all the questions from our attendees, which is wonderful. We certainly appreciate, again, your time, your expertise, in bringing this information to the spotlight for our clients. Again, at Towerpoint Wealth, our mission is to stand side by side with all of our clients in helping you remove the hassle of properly coordinating all of your financial affairs, certainly health insurance being part of that hassle, perhaps. So you can live a happier life and enjoy retirement. So we will have a full replay of the webinar posted on the Towerpoint Wealth YouTube channel, as well as our social media channels. So for all guests who want to recap or want to go back and revisit some of these issues, that'll be available. And again, we appreciate your time.